It is really an honor to have your time. And for the last 14 months, it's really been an amazing journey, a journey that has been hard, arduous, with a lot of just a lot of things, activities going on, a lot of misfortune with people who have died, to people who have survived, to people who just triumph all this 14 months. And I want to say that for both our staff, who no one in our staff has passed away, but they have worked so hard, and sometimes they feel like like they can't give anymore. Their work has been extraordinary, and I just want to acknowledge all of you who are on this call, staff of Mary Center and the board of Mary Center, with Michelle Klinger on the line, because it's been, you know, not only do we meet once a month, but we are also talking to you in between those meetings. So thank you, and to each and every one of you who are on this call, donors, friends, supporters, researchers that have helped us throughout this not only throughout this maybe 30 years, but throughout this 14 months. We thank you so much for just sticking with us, for being with us, and for supporting us. It meant so much, from you know, bringing food when we needed it for our staff, to doing the research that needed to be done during this period of time, to your money, to your support, and to your guidance, and to being able to pick up the phone and talk to you, and ask you questions, and feel reassured that the community was still with us. So thank you. Always just not surprised, but totally overwhelmed, and just amazed of the amount of support that each and everyone in the community has given us, and that includes you. And with that, it allows us, and it enables us to really recharge. As I told you a story of one particular client, Carlos, who was a mechanic. He worked for Advanced Auto Parts. He's a father, he's a husband, and a proud Mary Center participant. When the pandemic broke out, of course, like many people like him, were not able to actually telework, and so consequently, he caught COVID-19 in April of 2020. Till today, still, his voice is barely back, and still struggles to catch his breath. But he is healthier because of Mary Center. So that is a blessing. Carlos' sickness progressed rapidly, and according to him, he was close to death and could barely breathe or talk or move. He seek help at different hospitals, and the hospitals would not accept him because they were backed up at that time. They sent him back home and recommended that he continue to quarantine. His symptoms got worse, and the pain got worse. You know, his family basically gave up on him, and to add, you know, pain to injury, he actually developed mental health. His mental health just deteriorated little by little, and he points out that he remembers that he was in so much pain, he was feeling like he was suffocating, and in thinking one night that he would just want to jump off a bridge and end his life. Because he was scared, he was suffering, he was nervous about infecting his family, and so he thought that ending his own life would be better. So at the lowest moment in his time, and he says it's a miracle from God. He quotes, it's his quote. At his lowest moment in his time, he received a call from Dr. Hayashi, and that could have been any doctor, any nurse, any provider here at Mary Center. But this particular patient happened to be Dr. Hayashi. He had never met him, but Dr. Hayashi called him because he was on our roster as one of the high-risk participants that needed to be reached out to on that particular day, and that was the day after he was thinking of committing suicide. And so he remembers that as soon as he asked him about his symptoms, and he felt like God had sent him in his way, that Dr. Hayashi was sent by God to keep him alive. And so I just say that because you know, he got to the Mary Center. Dr. Hayashi, after he gave him the symptoms, he got to Mary Center, and immediately, of course, he was turned right into Washington Hospital Center, a hospital that was probably one of the hospitals that rejected him, but because he was a referral from Mary Center, he was accepted, he was treated, and he is just slowly recovering. But what he says is he has his life because of Mary Center. So I just want to reiterate that story because I think it's very poignant of what we do here every day at Mary Center. So again, in what you do, really with your support and the money that you provide us, and all the ways that you support here at Mary Center and support each one of us. Your like I say, your support really gives us the energy and the fuel to really continue to do what we do. So with that story, I would just, it's hard to continue really this meeting with other things, but I just wanted to say also that not because of the pandemic, but I was planning to anyway. I was planning to leave at the end of this year, and so later on in our conversation, Michelle Klinger, our board member, will be providing an update on that piece. And so now it's my privilege to introduce our Chief Medical Officer, Dr. Tollie Elliott, who has been extraordinary and has led us through the hard times in terms of the providers here at Mary Center, but also just helping me to understand the pandemic, helping me in our development department and everyone here at Mary Center to understand how to talk about the pandemic and how to give the facts. And so with that, I would like to turn it over to Dr. Elliott to provide some information about COVID-19 testing and vaccination here at Mary Center. Dr. Elliott?
Thank you, Maria. Thank you, and good morning, everyone. And again, I echo Maria's sentiments about a deep debt of gratitude for the support for all that we do. I would say that as a member of the team, and the story that Maria gave with Dr. Hayashi is just a perfect example. One of the things I wanted to add was that this morning we ran an interview, and the candidate actually asked us what was the one word we would describe Mary Center. And one of the nurses in the interview, she said family. And and as we were describing how all the different facets of Mary Center, from the board to the executive team, to the managers and directors, to the providers, to everybody internal to Mary Center, it does feel like family. And the one word that I added, I actually said startup. I said a portmanteau, because we're always tinkering with something. We're always our worst critic. We're always trying to do better on behalf of the patients. But as I listened this morning, there was one other word I would have used, and I would have said resilience. And I would like to say that the support that everyone on this call has provided has really done a lot to help us in terms of how we went through 2020 and how we navigated through that very difficult time that nobody knew at all what was going to happen the next month or the next week. And so your support has been tremendous. And I think the images on this slide absolutely show where that support went and the teams of people that went there. I would say in that top picture, we have the team of people standing right in front of the red tent. That is a COVID testing event, but that's our dental team. And so what we did is we said, hey, look, it's an all hands on deck opportunity. Let's see what we have. We had hygienists, we had dentists, and we had that dental team out there. And that was one of the first events that we did. I believe that was in April with DC Health. And that went remarkably well and tested quite a number of people in the community. And it has just been that way ever since. And so I'd like to go to the next slide, please. And so, we can be in meetings and we can go through all sorts of data, but the most important thing is that, the print is small, but the colors are quite obvious. There's red and then there's green. And what we're looking at is the number of negative tests versus the number of positive tests. And as you can see, back in April of last year, the positivity rate was high. And then there was another pop again this winter when you look at December and January, and those are those red lines. A good example of what we were experiencing on March 18th, the entire medical service line pivoted into telemedicine, and we took everything offline with a small exception of pregnant women, children up to 18 months, and then some adults that we felt as though they were highly relevant for them to come in and have that direct one-to-one care in the site. But it was a challenge, and this is definitely a testimony. And as you can see, we never stopped the process of testing. We went through testing outside in alleys. We went through testing where we actually had to modify internal spaces, but this really is a testament. And as you can see in November, that number in terms of the number of negative tests, and that's a peak in terms of how aggressive we were going in terms of trying to make an impact on the community and identify people. Next slide, please. So again, you have a slide here that talks about testing trends by sex and age group. And so in terms of the overall number of tests, we had 8,167 tests. We had nearly a 2-to-1 ratio of female to male. Again, fortunately for us, the positivity rate was not too high, but still concerning. And also what you'll also notice is that at the age of 30 and 39, that was the category that was at the highest with respect to the overall group. But what was interesting, you'll notice that in terms of the district count of male visits, the highest group that was nearly fairly high was actually the age group of 0 to 9, which was interesting that you had the youth that was there. One of the things I wanted to add that's not in this slide is that as a collective across all sites, DC and Maryland, Mary Center had the highest percentage of pregnant women that were positive. We have tested probably close to 175 positive, thank you, Sarah. We've tested close to 175 positive pregnant women with COVID, and we have not lost any, which is a testament to how we worked as a team, how the support you provided helped with that resiliency, and how we maintained being on top of that to make sure that the patients were plugged in, engaged. And in many situations, they didn't have access to prenatal care because many other centers were closed down and they had stopped doing services in a clinic-to-clinic setting. And so oftentimes we found ourselves using the OBGYNs working alongside the high-risk doctors because the access was very critical and hard to get to. And so, Sarah, can we go to that previous slide? Sorry. Thanks. So what you see is you see the testing trends by race and ethnicity. Certainly, it's pretty consistent across the board, but what's not showing up, and I think that what we're seeing out in the community in general and across the country, is that with Hispanics, African Americans, and Native Americans, they're twice as likely to get infected, 4 times as likely to be hospitalized, and 3 times as likely to die. And that's why it was so very, very, very important for us to start testing as aggressively as we could and make sure that we could test as many and as often as we could, especially family members, even when they were not Mary Center patients, because we knew that if we were able to capture one person, then we could start the process of social isolation, start the process of contact tracing. It was a difficult task. But again, we got through it towards the end of this year, but we're still not out of that. We can go to the next slide after that, Sarah. Thank you. So vaccination trends. What you're going to find early on in December, we started off with the first dose. We started off with Moderna. For certain reasons, we were using Moderna. Pfizer requires a colder storage setting, and that was isolated more so towards hospitals. As we started progressing, again, Pfizer started coming into play within the past month, but we're still not, you don't see that breakdown in terms of this slide with Pfizer and Moderna. We're just categorizing it as first dose and second dose. And we're also using the Johnson & Johnson. That Johnson & Johnson vaccine, we're using that as a second dose because it's a one-time shot. So in that case, we're looking at like it's fully vaccinated. However, because of the certain events that we've been seeing, we have limited our Johnson & Johnson supply. And we're trying to focus primarily on Pfizer right now because Pfizer has received the emergency use authorization for children 12 and up. There are studies out there right now where they're doing research to find children as young as 2 years old to get that. That probably won't be available and eligible till the fall. However, right now, our intent is to use the product that has a wider distribution so we can get more members of the family impacted and vaccinated. Next slide, please. Thank you. So vaccination trends by sex and age group. And again, what you're going to find is in terms of dose 1 and dose 2, our population for the most part, again, is 2 to 1 in terms of female to male. And this slide is pretty much reflective of that. We find that we have a better uptake in terms of men 60 to 69 in terms of getting that first and second dose. But again, we're still trying to get everybody. I think that what we're looking at right now and what we're going to start seeing in the future is that it's kind of hard to say the traditional ways of registering for a vaccine because people were getting online or people were coming into the clinic. We're actually moving into this non-traditional perspective of trying to get deeper into the communities that don't necessarily have access to the internet. They don't necessarily have access to the doctor's office. There might be non-traditional hours, but we're going to make sure that we focus on a continued element of engagement for all aspects of the community, in particular those that are disproportionately impacted. And so the slide that Sarah brought up is vaccination trends by race and ethnicity. You hear a lot in the news about vaccine hesitancy. I would say personally, it can come off as if it's victim blaming. There's reasons why people are concerned about taking the vaccine, and it's our part as an organization to show them grace, understanding, and educate them on why it makes sense and how it's relevant. And so although we may see trends in certain areas about how different communities adopt it, we're now finding that the real work and the efforts that is done is actually getting on the ground, getting into the community, and coming up with non-traditional ways to vaccinate. One of the things that I would like to mention is that we partnered with DC Health to work alongside with a group called 5 Medicine and the Faith and Vaccine Initiative. And that initiative started off focusing on African-American churches in wards 7 and 8. It was actually a unique experience. Lots of meetings, lots of very deliberate discussions, lots of intentional effort to make sure that we engage the churches as community hubs, finding credible messengers. And from there, it sprouted into this great program that is now beyond just African-American churches. It's now going into Hispanic churches. We have had an event at a predominantly Ethiopian church. One of the events that was a phenomenal success was at the Shrine of the Sacred Heart, which is just around the corner from our Ontario Road site. On day one, we had projected that we were going to vaccinate about 200 people. That day, they vaccinated 420. The Saturday, 2 days later, the vaccination clinic was to start at 10 a.m. There were people waiting in line as early as 6 in the morning. That day, again, we thought we were being aggressive at 250. We ended up vaccinating 450 people that day. And again, that was in concert with DC Health, Mary Center, 5 Medicine. That these efforts, these non-traditional ways of getting into the community have really made a huge difference in terms of trying to get and impact those communities that are disproportionately impacted. We go to the next slide. So that is our effort, and that is a very, very, very small glimpse of what we're doing. I would say that I am the messenger for an incredibly wonderful team of staff that is out there every day, that are on the phones. They're calling people to come in. They're educating people from patient care navigators, family support workers, medical assistants, nurses, health educators. Even the facilities people, encouraging them to go ahead and look, I got it, get it, the vaccine is safe. It is a tremendously wonderful effort. And that goes back to initially what I'd start off with saying that, the one word that I think that can sum this up is family. And I think that when there's a sense that we're all a part of this family, we start to make a difference in terms of how we're going to approach this, because that's the only way we're going to get through it.
Well, thank you so much, Dr. Elliott. It is indeed a family. We bicker and we laugh together, and we can't get together these days, but it truly is a family, and that's how I'm so privileged to have and to work around such incredible human beings that take it upon themselves to just not be told to do things, not be fearful to do things, but to just go out there and really not only fill the gaps, but think about gaps that might be coming along the way. And that's what happened with Dr. Elliott and his team. They were sort of chartering the way of like, okay, what is the next track? Let's see what we can prevent that. And so thank you again so much for that. I wanted to now introduce a dear friend of mine, a colleague, what we call a compatriot also. Tatiana is Mrs. Tatiana Torres, a well-known rounded business professional for nearly 18 years, with experience in the public, the private sector, and the nonprofit sector in philanthropy. As I said, she was born in Colombia, and she's very focused on investing her time, her talent, and the treasure in diverse communities. She currently works with the District of Columbia, and she is here today, though, in her personal capacity as a longtime friend and supporter of Mary Center. You see her at every event, just working, and people come to me and they say, "What department does she work in?" She puts in her shoes in there, and everybody just thinks she is an employee of Mary Center. So Tatiana, please take it.
Thank you, Maria. Muchas gracias. It's an honor and privilege to be here this morning with you all. Again, my name is Tatiana Torres, or Tatiana Torres, however you hear it. I am so happy to be joining all of you this morning. Mary Center, since the moment I got to DC 11 years ago, has had a very special place in my heart. And it is a very special place in my heart because as an immigrant from Colombia, I know the importance of healthcare in one's growing up in one's family. When we got to the United States as refugees from my country in the mid 80s due to the cartel and the issues in my country, both my parents were professionals and came to this country to clean floors and bathrooms, leaving everything behind for our protection. And we now as an adult, right, even just a few years back, realized that my parents did not have health care and we did not have health care. Even though we always were made sure to go to doctor's appointments, I never figured how they did it. And knowing how expensive healthcare was, I now look back and I asked them just a few years ago, how did you all do it? And they said, well, we had to do payment plans because we were undocumented and there was no way that we could pay a doctor's appointment or vaccines for you to go to school without having a doctor do that. You see, in New Jersey, there was no Mary Center where I was raised. There was no community where I could go to and say, hey, I'm undocumented with my parents or with my family. So having lived that experience personally and having been an immigrant, I support Mary Center wholeheartedly because I would never want people not to get the healthcare that they need, the attention that they need, mental health professionals, dental professionals that they need. And Mary Center provides that for our community in our region, under the leadership of a woman that I admire and respect, but her team also as dedicated as she is to serving people of color, to serving people that come to their door, regardless of their income, of their status. And I have been a supporter of Mary Center with my talent and treasure. Maria's right. There's many times during the Christmas holiday programs for the kids that I miss so dearly over the past 2 years because of COVID, over the last year because of COVID. I gave it my all because that would have been me. And that was me growing up. Sometimes there was no money to get toys or food or a day where we could enjoy it because mom and dad didn't have that opportunity. They were working too long. So Mary Center is a place where not only has it impacted me as a professional, but personally as well. My grandmother, my mother, and my aunt are patients of Mary Center. They go there. They feel like they are treated in their language, that they are cared for, a phone call away from attention that they need medically. They feel that they can talk to people in their language and that they are understood. I have friends whose children are part of Mary Center, friends that work with me that chose to go to Mary Center because the healthcare that is provided and the attention that is provided is better than a private doctor's office for most of them and for my family as well. So I would encourage you today, also in my personal capacity, to please donate, to contribute, to serve, to love, to support Mary Center at whatever level you can. Sometimes I call Heather on the weekends and say, hey, Heather, I have this brand new beautiful cloth that somebody's donated and bedding that someone's donated. Could you take it? And immediately I get a call back. It's not just supporting with your finances, which are truly important, but it's also supporting with your time, and it's also supporting with giving of your best to the community, not giving what you have left over, but giving of your best, because these are families like mine that are here now going through this season in their lives that deserve to get excellent treatment, that deserve to get the best because they're people and they're human. And especially during this time that we're living in, this uncertain time for many families, just because vaccinations are here and individuals are getting vaccinated, it doesn't mean that this pandemic is over. For some people, the impacts that this has had on them financially and emotionally and mentally are going to last for quite some time. So please also, as a person of faith, encourage people around you to get the vaccine. Encourage them to go to Mary Center and to serve. It's important. I grew up in a very Christian home, And I have been encouraging folks to go to Mary Center in my church and in my community to make sure that they get vaccinated. It is important that we all do so. So today I'll leave you with one thought. As you think about the next few months of equitably recovering and how we do that, and everyone talks about that, it's a buzzword, equity, and how important equity is, and equity. Think about how you can actually take action into that equity. And in my opinion, and very personal opinion, Mary Center has been working on equitably serving the community for 30 years. And it's not a new buzzword. It's not something that all of a sudden everyone says. It's something that they have lived for 30 years and will continue to do so by expanding and by growing, by giving access to education to women, by giving access to education to students, and by being with individuals trenched in the community. They're not looking 50,000 feet in above to what's happening. They are in the trenches. So to Maria and the team, thank you so much for the opportunity to speak here today. Thank you so much for serving my family, mi abuela, mi mamá, mi tía. Thank you for helping me get screened for COVID-19 when I needed it in the midst of the height of the pandemic. And I just want to thank you for the dedication that you have to my community, but all communities as well. And thank you for the service and the love and example that you give as a beacon of light, as I always call it, for our region. Thank you so much.
Thank you, Tatiana. You're really an inspiration, and there are so many people like Tatiana who support us, and we want to make sure that this is the next generation, right? The next generation of leaders, and someday we hope that you'll come back to the nonprofit and maybe run Mary Center, right? So, but anyway, thank you again, and you have such an amazing family, and you know, the providers here know your family by their first name, know who your family is, and that is part of what makes our providers here at Mary Center work so beautifully, right, and enjoy their work. Is that I have the privilege now to introduce, and it's a privilege and an honor to introduce one of our most dedicated board members, with her talent, her time, and her treasure. And not only is Michelle Klinger, our board member who does all of that, but she is the second one in her family to do that. Her husband Matt was a board member, and he and I talked about, like, why can't we bring Michelle to the board? And so she did. She agreed. Michelle is one of those board members that listens very quietly, and then proceeds to speak and take action whenever needed. And this is when one of the things that she took on is the transition for the search of a new CEO at Mary Center. And so we'd love to hear from her about what the process is, a little bit about Michelle, and then a little bit about the process that we're taking for the search. Michelle?
Wonderful. Thanks, Maria. It's great to be joining everybody today. As Maria said, my husband and I have been involved with Mary Center for now, I think, over a decade, which is just hard to believe. But we both began our careers working in healthcare, and it was actually through a volunteer event at our company that we first became exposed to Mary Center. And clearly we have a passion for the industry, but really it's, as we've gotten to know Mary Center and gotten to know the staff that are driving just such incredible outcomes and really serving the most vulnerable populations in our community, that we became convinced that we needed to support this organization. So as Maria said, my husband had a tour through the board. He served for 6 years, and I'm in my 4th year. And it really has been a gift for our whole family. We've enjoyed watching the organization grow over the years. But as Maria said, I was asked to join today to give everybody a little bit of visibility into our search for Mary Center's next CEO. I'm the chair of the search committee, and it's something that we've been carefully preparing for some time now. And as you see here on the slide, we did some extensive research and interviewed almost a dozen executive search firms before making the decision as a board to select Spencer Stuart as our partner to lead the search. Spencer Stuart might be a familiar organization to some of you. They're a leading global executive search firm, and they have a tremendous reputation. There are several things that really set them apart from the other firms we considered. One being their extensive experience with executive level searches for public health and nonprofit health organizations. That was very important to us. They also have a great successful track record in diversity placement. And this really results from what is a best practice search process that ensures inclusivity throughout the process, and mitigation of unconscious bias throughout as well. Another thing that really struck us in evaluating this partner is they take a team-based approach. So we actually have 4 individuals supporting our search efforts who are each in their own right are bringing tremendous experience to the table, relevant industry knowledge, expansive networks and relationships that we'll be able to leverage, local market expertise, but a national presence, and lots of search reps, right? They're pros at doing this. It also became very apparent through our conversations that they have such tremendous respect for Mary Center and the work that we do. And certainly that will be a huge asset, their attachment to our mission throughout this process. So Sarah, maybe if you can flip to the next slide. I know folks are eager for some visibility into the search, so I wanted to share a quick snapshot of the process and really what lies ahead for us. As you can see here, we hit the ground running earlier this year, and the first phase was really focused on alignment and research. The Spencer Stuart team has really taken time to get to know Mary Center, to get to know our history, our growth, our strategy, our vision for the future, all of that to help them really develop an understanding of the unique leadership skills we need today, as well as going forward. So the goal of this early work has really been to establish a forward-looking profile for the CEO, and to develop what they call a position specification. So this is a resource that includes a bunch of important information about Mary Center and the services that we provide. And it also outlines the ideal experience, the critical leadership skills, and the important personal characteristics that we'll be looking for in the future CEO. We really want to be sure that we are finding a leader who can build on the rich history of Mary Center, but also lead the organization in this next chapter as the industry continues to evolve. So the position specification is now complete, and it's being used to support the next phase of the search, which will be focused on outreach and candidate identification. Across the next several weeks, our goal is to source qualified candidates and establish a pool that will be evaluated over the summer by our search committee. And really, our aim is to identify the next CEO sort of, early to mid fall, so that we can ensure a smooth transition as Maria prepares for her next chapter. So, it's not lost on anyone in the search committee. This is an incredibly critically important charge for us. And we are confident that we will identify the right person to lead Mary Center in the years ahead. I do, if you will indulge me, I do have an ask of this group. We are going to be posting that position specification that I mentioned to Mary Center's website in the next few days, and we will be circulating a link to this group. And I'd ask everybody to please review it, share it widely within your networks, send us any nominations you might have for the role. We need as many Mary Center champions as possible helping us to promote this opportunity. So I would thank you in advance for your help there. And I know we need to pivot to questions, but before I hand things over, I think, to Heather, I just wanted to personally thank everyone, each of you, on behalf of the entire board. Your support and engagement with Mary Center is so important. You truly are a part of this Mary Center family, as Dr. Elliott said earlier, and we definitely could not be achieving the outcomes that we do without your commitment. So I appreciate the opportunity to be with you all today. Thank you.
Michelle, thank you so much for this wonderful update and your very kind words. And thank you for your dedication as a board member to Mary Center. Your commitment to our mission is just remarkable, and we're truly grateful. So thank you. Now, we will open up the floor for our question and answer portion of our event. My colleague, Sarah Harwitz, she will read the questions aloud, and we will continue to take questions in the chat as well.
Thank you, Heather. So we have one question that was asked, and I'm going to read it aloud. There are so many ways in which we can support Mary Center. How would you prioritize the type of support that average volunteer or donor can offer?
I will take that question, if you don't mind. I'll start anyway. I have so many ways that this group could help. I think the first one is just to think about potential board members that you can refer to us. We are desperately needing people in the business world and the finance world and also in healthcare policy. So please, 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 that would be amazing. The other is if you have a company, if you have the treasurer, if you have the means of how to support in a way that we can have somebody that can support the next CEO who will come to Mary Center to be able to have those funds, to be able to have that person have someone that they can, go to. It's very lonely, as all of you know. It's very lonely at the top, and it's hard to kind of bring down your filter that stuff down to your employees, especially if you're a new CEO. So that support would be really great. Sending us your talent. In addition, some people that now work for Mary Center have been sent to us by people like yourselves, and so talent is there's a lot of talent out there, but wonderful talent that can fit the mission of Mary Center is really, really important. So please send us the talent. Of course, connections to other potential resources is really, really, really encouraged. And in terms of that is corporations and national foundations is something that Mary Center is desperately continuing to search because of the size of the budget that we have now. We really want to look at larger organizations that can support us, and then just your resources that if they can continue to be general support would be really, really amazing. So thank you so much for that. I don't know, Heather, if you want to add anything else.
Yes. Oh, thank you, Maria. Yes, and just to add on to what Maria was coming, we know that everyone is at different stages of their lives, and what they can offer to give may differ from person to person or even day to day. So all I'd like to say is if you have, something you'd like to talk to us about, please I encourage you to reach out and we'll discuss with you the best way that you can support us. We love to talk to you. So thank you.
Thank you, Maria and Heather. We have another question, and Dr. Elliott, I believe this is for you. What are some of the misgivings that people in the immigrant community have? I believe this is regarding the vaccine, the COVID-19 vaccine.
I think one of the things that I see is that they don't feel as though they're seen and heard. I think that it's okay to call them essential workers when you need them, but then when you want to really get out there and take care of them, they don't feel as though they've been received the way they should have been and deserve to be. And I think that these efforts that we do, the Shrine of the Sacred Heart is a predominantly Latinx church, and that was an incredible testament. And Father Emilio was like incredible, as well as the rest of his staff and team. That is a statement that, when you hear about vaccine hesitancy, when you listen to them, when you take the time, when you talk, when you engage, people respond. And so I think that that's a clear testament. They need to be seen and heard. And I think that that's where some of that comes from.
And I think we need to continue to do a lot of education around the vaccine in pregnant women and children now that we have children. And even if we go lower than 12, that's really going to be people already. These kids have so many vaccinations, and how we tailor that messaging and how we get it out there is going to be very, very important. So thank you, Dr. Elliott.
Thank you, Maria and Dr. Elliott. Those are the last questions that we have. So we're actually at good timing to prepare for wrapping up, and I'm just going to share my screen one more time, so bear with me. And Heather,
Okay.
Yes,
Yes, thank you.
that we can answer in terms of Mary Center or the transition or the vaccinations. Okay. All right. Great. Well,
no.
Okay. Well, we're always here. So this has been absolutely wonderful for us to engage with you, our very special supporters and advocates for our work. We thank you for your time and your commitment really to the communities who very much need our services. And we have just one more favor to ask, and that's that you please share with your friends, your family, your work colleagues, your neighbors, anyone that you come in contact with the great work that's taking place at Mary Center. And one way to do this is to follow our social media channels, which is displayed on the screen here, and to like our posts. We post quite often. We're on Facebook, Instagram, LinkedIn, and Twitter. So there's something there for everyone. And by liking and sharing our posts, you really help spread the word about Mary Center to people who may not know about us. So with that, our program will come to a close today, but please know that we're really just a phone call or an email away. As I said, we love to hear from you. So please reach out, and I hope everyone has a wonderful, wonderful weekend. Thank you.